Chancellor of the University of Maryland system, Dr. J. Perman, who used to be the president of University of Maryland, Baltimore, and set in motion many of the initiatives that you've heard about during the summit. And I hope you enjoyed, Dr. Perman. It's nice to see you. I hope you enjoyed some of the things that you heard briefly. We're so happy to close this summit that seemed to race by. There's so much to talk about, but I think we've really heard from the students, and this is a good starting point. So thank you for joining us, and I'll turn it over to you.
Thank you, Virginia. I have been listening. I've learned a lot, even in the short time that I've been listening to the panelists reacting, and I apologize for my role in shortening the session. But thank you for having me. Thank you to everyone participating in this terribly important summit. I'm so happy to see the work that a number of us began together flourishing like this. It's hard for me to believe that it was 2 years ago that we last gathered around this time of the year at such a summit. Somebody mentioned Dr. So. I was in the audience the last time when Dr. So brought down the house with his keynote, recalling the Ebola crisis in Mali and how he and his colleagues at CVD Mali waged an effective war against the disease. I remember thinking at that time how lucky we were to work with him, how lucky we were to learn from him, and really from all the colleagues who at that time came from around the world to share their expertise with us. One of the panelists mentioned the importance of bi-directional learning. Just a few months after that summit, I had the privilege to travel with some of you to Zambia and Botswana to see some of our partners work firsthand. At that time, I also had the privilege of meeting with colleagues from Kenya, Rwanda, Tanzania, Nigeria. And then, of course, we succumb to disease on a global scale. And again, I think how much better we are for this global health infrastructure we're building, how fortunate we are to rely on the deep knowledge of our international partners, how blessed we are for their collaboration. But you know, nothing clarifies the failings of global health quite like a catastrophe. And this pandemic invites us to examine where neo-colonialism continues to infect our conceptions, not just of global health interventions, but of global health itself. And potentially who becomes our next generation of global health scholars and practitioners, how these professionals are trained, how their work is disseminated, how their ideas gain influence. This work is, of course, and I'm mindful of this, intersecting with the United States' own reckoning on race, our examination of the systems and structures designed to disadvantage populations, and our dissection of academia itself, which has historically admitted and amplified certain voices over others. The colonizing of global health is, in my view, not so far from the gatekeeping of the academy. What you're doing is rewriting narratives long accepted as truth, rewiring practices long accepted as best. What you're doing is dismantling centuries of racial and cultural hegemony that frankly have perpetuated unequal access, unequal influence, and unequal power. It's a challenge. I admit it's a challenge for me. And so I'm very proud of the students who are leading this work, the students who really walk the walk of global health education, equity, and inclusion, and who hold our feet to the fire to do the same. I thank President Gerald, Dr. Fyron Guzman, the Center for Global Engagement, and all of you who have contributed to this terribly important conversation. Thank you for letting me say a few words.
Well, thank you very much, Dr. Perman, really from the bottom of our hearts for your leadership and allowing us to have these conversations. It means a lot, and we're so grateful, and it's so fitting that you can be here to share your words to close out the summit. So on behalf of the summit planning team and everyone that was involved, thank you all for attending. And we will be back in touch with recordings and more information. But again, thank you to everyone, and have a good rest of your day.